Hi, I'm Matt. I'm part of the physiotherapy team here at Wiltshire Health and Care. We have created this series of short videos about rotator cuff related shoulder pain, a common cause of shoulder pain. This series is made up of 3 videos, each with a different focus. The aim of these videos is to provide you with the information to manage your shoulder pain. In this video, video 1, we will look at what is rotator cuff related shoulder pain, the anatomy of the shoulder, evidence surrounding imaging in shoulder pain, and an overview of your management options and expectations moving forward. In videos 2 and 3, we'll explore the topic of pain and pain management, flare-ups, and go through some exercises for your shoulder. So, what is rotator cuff related shoulder pain? Rotator cuff related shoulder pain is irritation to the shoulder muscles that can restrict movement and cause pain. It can appear suddenly or develop over a period of time. There may not be an apparent cause as to what has triggered it. Usually, it can be associated with overuse, weakness around the shoulder, and in some cases, even minor trauma. The pain can often be felt coming from the upper arm and will cause difficulties with overhead activities, lifting, and even driving. So, what are the rotator cuff muscles and what does the shoulder look like? The shoulder is made up of 3 bones: your humerus, or your upper arm bone, which you can see here on this image, your clavicle or collarbone, which you can see here on these images, or your shoulder blade, or your scapula, which can be seen here on these images. The shoulder is a very mobile joint. This is because it is a ball and socket joint. As a result, it is inherently less stable. It's surrounded by muscles and ligaments that help with this, although the ligaments aren't the strongest around the shoulder. As a result, the rotator cuff muscles are very important. The rotator cuff muscles are a group of 4 muscles around the shoulder. You have 3 that are located on the back of your shoulder blade, as you can see on this image, and they attach onto the back and upper part of your arm. And you have 1 located on the front of your shoulder blade that attaches onto the front of your upper arm at the top. When you move your arm, they act as a unit, providing stability around the shoulder joint, but they also assist to enable smooth and efficient movement. Due to their function, they can easily become irritated and develop tears over time. Yet not everyone will develop symptoms due to this, and we explore this later in this video. So, how common is shoulder pain? Approximately 1 to 2% of adults present to their GP with shoulder pain, and about 70% of shoulder pain is due to rotator cuff. This equates to about 2 million patients seeking help for their shoulder pain related to rotator cuff injuries every year, as you can see by this graphic on the side of the screen. Unfortunately, this is a growing problem, and one of the reasons we suspect this is a growing problem is due to our ageing population. So what about imaging in relation to shoulder pain? So recent evidence suggests that current systems to classify shoulder pain are unreliable and often not appropriate in describing the cause of your shoulder pain. You may have even heard the phrase impingement used as a way of describing your symptoms. Unfortunately, this is not a reliable way of explaining the symptoms. This has been demonstrated in recent research, which has shown us that the symptoms are less likely to be due to contact between your bones and your muscles, but more likely to be because of dysfunction or an inability of the rotator cuff muscles to properly perform their job and their role. And this has been demonstrated due to the location of where the changes have occurred within these structures, as it's occurring in areas that don't necessarily correlate to where the suspected contact would be being made. Some people may have had their shoulder investigated through either X-rays or ultrasound scans, and this may have shown some changes. However, evidence suggests that structural changes are just as common in those of us with symptoms as those of us without symptoms. One study in particular found that 96% of people with no shoulder pain or loss of function had changes on their investigations, such as tears or thickening of certain structures in the area, as well as other changes. And this shows us that the changes are often not the reason for your symptoms. Usually, the changes are more related to our aging rather than pain, similar to grey hairs and wrinkles. The evidence further suggests that the level of change within the rotator cuff structures has been shown to not represent accurately the severity of symptoms. And this is because symptoms and pain are often multifaceted. And this is something that we explore in more detail in video 2. So, what are the methods of managing your shoulder pain and getting you on the road to recovery? First and foremost, education and evidence-based exercise are where we start with the management of your symptoms. Some of the ways we approach this are through activity. This can be maintaining or increasing your activity levels as you're able to. However, this isn't always possible due to pain. And how can we combat that? So medication is one of the ways we go about that. So that can be through making sure you take appropriate medication to allow you to remain active and engage with your shoulder exercises. One of the other ways is through sleep. So evidence has indicated there is an association between sleep quality and an individual's levels of pain. So finding ways to maximise and improve your sleep can help your symptoms. Other ways you can help your symptoms are through hot and cold therapy, such as ice or heat, whichever one you prefer. For about 10 to 20 minutes has been over the affected area has been shown to help pain levels. It's just important that you monitor your skin to make sure you aren't burning yourself and place an item between your skin and the item you're using so that you reduce this risk. So, what can you expect from your shoulder? Most first-time episodes of shoulder pain can take up to 3 months to see significant improvements and may require ongoing work up to 6 months after you start the recovery process. If this isn't the first time you've experienced shoulder pain, it often requires a minimum of 6 months to see improvement. So it's important that you are consistent and stick to the program throughout that time. If you are not seeing improvements over this 3-month period, that's when your physiotherapist will potentially discuss other options with you if you've tried everything we've suggested and you still aren't getting it in these timelines. And that may involve an onward referral to some of our orthopaedic colleagues to discuss other options with them. So this is the end of video 1 on rotator cuff related shoulder pain. Please join me for video 2 where we explore pain and pain management and the importance of understanding what's going on.